By listening to this podcast, you agree to not use this podcast as medical advice to treat any medical condition in yourself or others, including, but not limited to, patients that you are treating. Consult your own physician for any medical issues that you may be having. This entire disclaimer also applies to any guests or contributors to the podcast. Under no circumstances shall any guests or contributors to the podcast or any employees, associates, or affiliates of the Neuroendocrine Cancer Awareness Network be responsible for damages arising from use of this podcast. Welcome, everybody, to another edition of Let's Get Real with NCAN. I'm your host, Mike Wayman. Thank you for joining us. Thank you for joining us in Charlotte last month. It was a really great conference, a really awesome turnout. We have another one coming up in June in Minneapolis. That's going to include Dr. Thor Halfdanarson. So Minneapolis first, nation over cancer awareness. And those of you who are hoping to get to the Birmingham conference in Alabama back in March, but it was unfortunately canceled, we have rescheduled it. It is going to be in the same location with the same lineup of doctors, headed up by Dr. Bart Rose. That is on July 19th. And again, more information over at netcancerawareness.org. We also will be dropping our full conference from Charlotte. It was a really great conference, and one of the speakers at that conference is joining us today. I would like to welcome Rachel Miller. How are you?
Good morning. Hi, how are you doing?
Very good, very good. I'm happy you're on. I'm happy you're doing this with us because I think that something that is it's a very hard subject to cover when it comes to NET is diet and nutrition and all that stuff. It's definitely super important. I know everybody is kind of excited about new medications and new modalities like histotripsy and all that kind of stuff, but something that they can do right off the bat without doctors' prescriptions or anything like that is work on their diet. And that's what I want to talk about with you today. So can you just let us know a little bit about yourself? I know you're, everybody knows that you're a part of the University of Kentucky. You're there with Dr. Lowell Anthony. So it is a center of NET excellence for sure. So just tell us a little bit about yourself and your journey.
Yeah, thank you. I have been at the UK Markey Cancer Center for 13 years now, and have really found that participating in the NET program has been one of my interests and rewarding. It's so challenging for our patients, and so if I can help anybody feel a little bit better about what they're eating, that they're not doing anything wrong or anything to harm themselves. Those are common fears, or people think they should stay away from certain foods. If I can make somebody feel a little bit more confident about that, then I feel that I've done a good job. Like I said, everyone is very unique in their situations, even if we have similar diagnoses. So I am fortunate enough to be able to spend all the time that we need to sit down and talk about nutrition and go over information that they may have come across online, or questions that they've come up with, or advice from family members, or if a patient is really struggling with some weight loss, then we're talking about that, or any other nutrition-related condition they might be facing. And then, of course, we are always talking about NET-related diarrhea. But I focus on a lot of that with Dr. Anthony's patients, and have follow-up kind of as needed, a lot of in-person visits, but also talking over the phone. So I've really found that this is kind of a unique area of oncology that I enjoy working with.
Yeah. Now, something that most people don't normally see, they normally see dietitian. So, what is the difference between a dietitian and an oncology dietitian?
Well, registered dietitians work often in the healthcare settings and inpatient settings, outpatient settings. As an oncology dietitian, I am focused. I do only oncology, but I do have a certification. Have a I'm board certified specialized in oncology nutrition, which requires a national exam that you have to take and be caught up on every 5 years actually. So that's my specialty is oncology nutrition, which of course includes NETs, and so that's the difference between me. So I'm more specialized in that area.
Yeah. Now, so in the role of, because again, like I said, we always tell patients you have to go to a specialized center, multidisciplinary approach to your treatment, super important. What do you feel is, because I think that dietitian and nutrition and that kind of stuff is often kind of an afterthought a little bit. But to you, what do you feel is the role of nutrition and the dietitian in a patient's diagnosis and treatment?
I think it's a very critical part because we're there to support them through completing therapy and whatever treatments they may be facing to keep them strong enough for those treatments and out of the hospital, and so that we have positive outcomes. And so nutrition is cumulative. If we are consistently working on that and building a strong nutrition status, then we're preparing you to be able to face all those other challenges. We want to maintain lean body mass so that we have enough energy and stamina to withstand some of those things. Or if you fall ill, you have the strength to recover more quickly and not cause a pause in some of your therapy. So it's vital. It's a piece of your foundation of your health. Frankly, a healthy diet, but also if we need to make changes that are related to any clinical concerns and symptoms, then that's something that we're focusing on as well.
Sure, sure. Now, to those people who are afraid of going, well, I don't want to see a nutritionist or a dietitian because they're going to just take away my joy and everything that I like about food and this and that. Um, can you just kind of elaborate a little bit more on your approach to somebody who does need to make some changes in their life, but you know, uh, I feel like it's painted with a picture of negativity,
Mhm.
and completely just abstinent to anything good. And
Yeah.
can you just elaborate on
Mhm.
the approach to something like that?
Yeah. Well, we can all afford to make healthier choices. But yeah, that sometimes is often the stigma that I'm a dietitian, and so I'm here to um, tell you can't have this and you can't have that, and you can have no junk food and no joy in food, and that's just not the truth. Or I'm there to, you know, make you lose weight because you need to, or I'm here to tell you that you need to do a complete 180, and that's simply not true. You know, I am here to help you identify how we can optimize you and your health the best way possible. So yeah, that includes healthy eating, but it also helps. It also includes identifying what are we facing clinically and symptomatically that we can work on together. It also includes all foods fit. So I'm not here to change anybody's you know um change what people enjoy. I'm not here to change that. You know, here to help kind of just optimize what we're doing, because we also consider quality of life, and part of that is the food that we eat and the people that we share our food with. And so that's something that I support. And how does that fit into your healthier lifestyle and what you need to thrive?
Right, right. I think that's a big misconception that uh, I think a lot of people worry about that. They worry about, oh well, now it's just it's salads and this and just vegetables and no more red meat, and that's just simply not the case. And I think that unfortunately there's not enough of that talked about, because I think that a lot of people get sensitive to it and go, oh, okay, then I can just go off the deep
Yeah.
end.
Yeah.
I mean, in a lot of cases, NET patients can't have salad. They shouldn't have raw vegetables and stuff like that, from what I understand, right? That's
Sometimes, depending on what you're tolerating, depending on what is going on in your GI tract, there's so many other things that are healthy vegetables besides salad that we can work in. There's so many options, but yeah, it's no judgment. We're all human. We all have lives and families and things going on, and so it's kind of working on how can we make this best work for you, and so that you feel well and that you feel well about what you're doing, because we definitely don't want to shame or scold anyone about eating, because that is a very personal thing for all of us.
absolutely, absolutely. What would you say, in a general sense, in just kind of like a blanketed uh, kind of sense, what are some things that a NET patient should absolutely avoid? Not, again, I feel like there's a delicate balance where you're like, okay, you should avoid this, but somebody who really, really enjoys it, you kind of like, all right, well, every once in a while, as long as you're prepared and you know what kind of pain you're going to be
Yeah.
in for a little bit, like what are some of the A1 across the board definitely you should probably avoid?
So I help people identify what they're sensitive to and what may give them GI upset or flushing or diarrhea. And so I would say, once we get a handle on that, you know that it's a stress on on your system. So within reason, we're maybe, if we know that we have flushing every time we have ripe bananas or avocados or coffee, chocolate, alcohol, what have you, then then maybe we don't continually stress our bodies. But then there's also special occasions. So the patient has the choice and autonomy to decide, you know, what what's going to work best for them. I want my patients to be well, and so um, yeah, I work to help identify some of those things that are going to be an issue, so that we know, going into a special occasion or going into a restaurant or a party or something, that they know what they can choose or avoid that's going to make them feel their best.
Great. Yeah, yeah. Are there any foods in particular that you find to be uh, very impactful toward a positive uh, quality of life and ability to live with NET?
Mhm. Yeah, yeah, definitely. Net patients usually have higher protein requirements, so we do focus on that. And of course, your protein foods are lean meats, eggs, fish, beans, dairy products as tolerated. Um, that in combination with plenty of fruits and vegetables and beneficial foods, and consistency of consuming those beneficial foods, and whole grains and enough fiber, and in a modification that's individual enough that can help you feel well and optimize your health and longevity, for sure.
And so, like, when you got into the field of dietary and nutrition. Um, what led you to focus in on more of the oncology side of things and net? Like what took you from this kind of broad spectrum of being able to treat somebody to a very specific modality, kind of?
I think I became interested in oncology just by being exposed to a lot of different health conditions and illness and disease, and learning that it is a very diverse patient population, um, and it's a set of unique needs, and so you've got oncology, and then you have NETs, which is even more unique and specialized. And so I kind of became interested in being able to be that support for someone, because cancer is so complex. As are all chronic conditions, but cancer especially, I feel, can hit you more ways than one. And so that's where I've enjoyed helping people.
Yeah. Um, how net focused would you say your practice is?
Well, we see people from all over the country. And I do see net patients. There's a couple days a week that Dr. Anthony has his clinic, but I'm also on the phone. So it is a portion of what I do. Um, so it's not maybe 50%, but it is a decent portion. And I have been working with these patients for about the 13 years that I've been here, and learned a lot.
That's great. That's great. What would you say is the most important thing for somebody who's been diagnosed with NET? What do you think the most important thing they do first is?
I think it's proper information, and I think it's getting a team of knowledgeable people around you, so that you can, you start to unfold all the layers. So, you may not meet with a dietitian at the beginning of your diagnosis, because you have to learn about what this condition is, and you have to be able to make sure you feel confident in your medical team and care team. And so then that kind of nutrition support comes in, maybe next step. But I think definitely having the appropriate information, and being able to sort out what we're reading. We all are exposed to the internet. We're all constantly reading and learning about things, and especially when it's happening to you. I think being confident in that you are receiving evidence-based information and recommendations is very important.
Absolutely. And as far as patient care, why do you think that it's so important for a patient to be involved with their treatment, as opposed to just kind of giving it to the doctors and being on autopilot?
Well, because I think that, while the doctor and team is familiar with this condition, they need to be familiar with you as a patient. So giving information, because sometimes, the questions may not always come up, but if there's something that's pertinent that is going on with you, that, tell us, um, because you may not have the same symptoms as someone else we see. And so I always offer information. Anything that changes, we want to know. So I think advocating for yourself in giving as much information as you can, but also asking questions and seeing, how does this fit into your life? Where are you in the country? What's going on in your world, and how can we fit in, appointments and procedures and therapy that's best for you. So, or if something doesn't doesn't sound right or you have a question, always ask. Always.
And finally, what is one kind of like a little bit of a tip that you could bestow upon just a general audience of net patients? What's a tip that may be super obvious, but needs a little bit of a reminder, or something that you just wouldn't necessarily think of that's super important to their journey?
I think it's to remind yourself that you are doing an okay job. You can let yourself off the hook. You can give yourself some grace. There's no perfect way to do this. You are a confident operating adult, and just remembering that, you're facing something that may be unknown, but um, you know, I guess to not worry that you yourself are doing something wrong. You are not responsible for the all this entirety of the treatment and making sure you eat perfectly. I think it's just to not pressure yourself so much. It your team's here to help you, and the focus is on you. So I think just being my tip then I would say is be kind to yourself.
Yeah, I think that's super important. I think the mental health aspect of the treatment plan is now starting to become a little bit more prevalent, and I think it's super important that people do recognize that it's not easy to navigate, but pat yourself on the back every once in a while,
Hmm.
because
Yeah.
you are going through it, and yeah, you're doing a good job. So, Rachel, thank you so much for coming on and joining us, and telling us a little bit about yourself and the practice and the importance of nutrition, and it not being a set thing, and it not being just one size fits all, and not taking away your complete freedoms. I do think that we need to spread that word a little bit more.
Yeah.
I think there, but I do think there are definitely nutritionists and dietitians out there that do kind of push that a little bit hard when they come to conferences, because they're not necessarily from this space.
Hmm.
And but you do a perfect job at it, and give us great balance. So thank you very much, and thank from the net community. Thank you.
Oh, well, thank
Um,
you for that. I'm glad to be a part of that.
Yeah. So hopefully we get to see you at a conference sometime soon again. Speaking of the conferences, again, we have Minneapolis in June. We have Birmingham in July. We do have a couple of more coming this year, including New Brunswick, New Jersey in October, as well as a partial Spanish speaking conference in December in
Great.
Miami. So that'll be really awesome. Stay tuned for more news on that. But anything else you need to know, definitely go over to netcancerawareness.org. And that's where you'll find all the information on all of our events. And we will see you next time on Nets Get Real.